Hello and welcome to SRG's Medicine. Today, on this video on Respiratory Medicine Series, we shall be continuing our journey with cough. We shall note that till now, from the first video on cough, we have been increasing the amount of clinical importance on the videos. So subsequently, this video has more clinical importance as compared to the previous video. So the contents of this video are the serious disorders which are not to be missed during diagnosis, red flag pointers for cough which points to these serious disorders, how to take history for a patient with cough, and ultimately summarizing this video. Let's start on with the serious disorders which are not to be missed. So the serious disorders which are not to be missed are fatal and treatable causes. So we have to look on to two things, the conditions which are fatal and those fatal conditions must be treatable. These include cardiac conditions such as left ventricular failure, infection such as tuberculosis, pneumonia, influenza, HIV infection, pulmonary conditions such as asthma, pneumothorax, foreign bodies. Then we talk about malignancies such as lung cancer and ultimately genetic diseases such as cystic fibrosis. So these are the serious disorders which are not to be missed because they are fatal as well as treatable. So moving on with the red flag pointers for cough. Here, these conditions or these specific things are the things that point towards those fatal and treatable causes. So elderly person. So any elderly presenting with cough are more likely to present with those fatal and treatable causes. And the other thing that we have to talk about is smoking history and asbestos history, because these conditions predispose towards pulmonary diseases. Now, persistent cough is also pointing towards some fatal conditions. Overseas travel and tuberculosis exposure points towards infection, whereas hemoptysis, unexplained weight loss, and dyspnea most commonly presents towards neoplastic condition or thromboembolic conditions. So these are the red flag pointers for now talking towards history taking. So let's clear one thing here. That is, history taking is quite an important part of diagnostic procedure. So after taking history of a patient, we come to know about the most probable diagnosis, and then after that, we conduct specific laboratory investigation or clinical examination so as to confirm those probable diagnoses. So history taking is the initial and most important part of diagnostic procedure. So let's start on. So for a patient with cough, we have to first start with an open question. That is, how would you describe your cough? Here, the patient can describe cough based on different things. So whether that is productive or not, he might describe the timing, he might describe exacerbating factor, but he might not describe everything. So it is your responsibility as a clinician to take out the relevant information from him, which you, so you will be asking closed question after that. So that is, how long have you had the cough? You'll ask about duration. You'll also ask about secretion, whether that is productive or non-productive cough. And if productive, what is the secretion, whether that's sputum or whether that's blood, and what's the amount of secretion. After that, you'll ask about the timing in which cough is more prominent. Then you'll also ask about sputum. So if the cough with which the patient is presenting is productive cough, then you'll ask about the sputum in terms of color, consistency, smell, and amount. After that, you'll also ask about some other associated symptoms that the patient has noted. So these were the questions which are directly related to cough. Now we'll ask about associated factors and other history. So you'll ask about whether there are any kind of exacerbating factor. Now I'd like to point over here the conditions in which exacerbating factor is quite important and must not be missed. So if the cough is exacerbated during meals or after meals, then it might commonly be GI tract causes such as tracheoesophageal fistula, gastroesophageal reflux, hiatus, herniation, or esophageal diverticulum. So these conditions are most likely to be missed So they must not be missed because we have been asking the question about exacerbating factor. Now the patient might tell about cough exacerbated after meal. So the other question that we will be asking over here is whether the patient has noted any kind of chest pain, fever, heartburn, or wheezing after cough or during cough. And then we'll ask about whether the person has anyone in the family with tuberculosis or malignancy or asthmatic condition. Then we'll also ask about whether the position of patient has any effect on cough. Here, the conditions can be the cough might be exacerbated on leaning forward. So if that happens, then we might have to think about bronchiectasis, aortic aneurysms, tracheobronchomalacia, or esophageal diverticulum. Whereas if the cough exacerbate on lying down flat, that is during sleeping flat, then on that condition, it might point towards pulmonary edema, congestive cardiac failure, and gastroesophageal reflux. So this is an important question which we need to ask the patient, whether the position of the patient has any effect on the cough. Now, the next thing that we need to ask is about the present and past occupational history, because that gives us about knowledge about whether there are any risk factor present in the patient. And we have to ask about exposure to birds, because exposure to birds, more specifically pigeons and parrots, have been linked or have increased risk towards Chlamydophila psittaci infection, that is psittacosis. So this Chlamydophila causes a typical pneumonia, and the treatment modalities as well as diagnostic procedures or presenting signs and symptoms are different in normally presenting common community acquired pneumonia and atypical pneumonia, which is due to psittacosis. So we have to ask about the exposure to birds. The next thing that we need to ask is smoking history in pack years. So here, pack year means the amount smoked by a person. So, or let's say, if a person smokes 20 cigarettes a day, that means a pack per day. Then, if he smokes for the duration of 1 year, then that amount of smoking is known as one pack year. So that's how we represent the history of smoking. So history of smoking in pack years was quite important and also is quite relevant nowadays. But it has been noted that it is not the only sole factor which might point towards the risk of malignancy. So it is quite important because conventionally we have been keeping smoking history in terms of pack years because we have felt before and also now we feel that smoking of at least 20 pack years have increased risk of malignancy. Research are going on in this field. Now, the next question that you would like to ask over here is, have you noticed any swelling on legs or have you had any kind of recent operations or been confined to bed? Because these factors points towards the risk of thromboembolic disorders, whether that might be pulmonary embolism, deep venous thrombosis, or other causes which might cause cough. And these, to be noted, are fatal conditions. These thromboembolic conditions are fatal and they must be noted. So these are the questions that you would like to ask in history taking. So let's summarize this video. In this video, we have talked about few fatal and treatable causes which have temporal relationship to outcome and must not be missed. Here, by temporal relationship, I mean that if the disease is found out or diagnosed early, then treating them early can lead to better outcome. And the next thing was we talked about those red flag signs which pointed to the fatal and treatable causes. And not only that, we also talked about history taking and how history taking is an essential part of diagnostic procedure. Then we talked about history taking uh, and its modalities. We told that history taking should be performed first, starting on with the questions of cough. And we have to find out relevant information on cough. And once we find out the relevant information on cough, it will be easier because we know the causes based on type of cough. So we can rule out the most probable diagnosis and use it for investigation. So history taking is effective to perform according to classification of cough. This is the summary of video. Hope you enjoyed it. Thank you.